Welcome to my channel. If you don't know me, I'm Eva and I'm fitness trainer. On my channel you will find everything about staying active, so like short workouts, testing of some different sport and activities, and talking about workouts. And now lately, because I'm over 40, I started to talk a little bit more about perimenopause. You might think it's a little bit too early, but actually it can affect women from 35. So if you are over 40, you might see already slowly some symptoms of perimenopause, maybe some hormonal shifts. You can see your body changing without any reason because you didn't change anything with your workouts or how you eat. You might have some mood swings. So really like slight symptoms that are not really menopause, but you might feel different than before, and you might think like, what's going on? I didn't change anything. Why is my body changing? And that's why I started to talk about it, because it's also affected me, and I was like surprised. Maybe no one told me. The doctors are saying I'm fine, everything is okay, and I am fine, I'm healthy, everything is okay, but the changes are visible. I put some questions on Instagram and I chose few of them about perimenopause, about my channel, and I will just reply a few of them quickly. First question that was interesting was, what kind of training is optimal for perimenopause and why? Training that you can do is strength training, lifting heavy. And we'll talk about it a bit later. That's the next question. Stay with me. And HIIT workouts. So really strong stressors to your body, because after 40, our female hormone levels are getting lower, and you don't get help of them anymore to stay healthy. So what you need are strong stressors, the signals to your brain to build your muscles. It will protect you, your joints, your bones. So what you need to do, you have to adjust the training to your needs. So it's not training more, it's not about eating less, it's about fueling. So you have to eat enough, not too much, but enough to fuel your body for strength training, for HIIT training. And it doesn't have to be long, it can be half an hour, 40 minutes. This was the first question. But what does it mean to lift heavy? Someone asked. Yes, lift heavy doesn't mean that you have to start with 20 kilo if you have never trained before. So the first thing is, for sure, you start with your own body to learn the workout, to learn how to work out, to prepare your body for the movements, to learn how to train without injuring yourself. Because of course, if you start with lifting now, you have never lifted, you are 45, and then you start with 30-40 kilo, you might injure your joints. So the thing for everyone, lifting heavy means something else. If you have never lifted, start with 2 kilo, 1 kilo maybe without weight, just to learn proper movement, and then you can slowly, progressively overload. So what I recommend, highly recommend, talk to someone. It doesn't have to be trainer, but maybe you know some trainer or you are at the gym, and you can ask how to perform the exercise properly so you can safely, progressively overload, not to injure yourself. Or someone that knows something about it, yes, your friend that is training a lot and she knows or he knows how to do it. So you really train safely. So you don't start with 20-30 kilo, small. You start small, you have to earn to lift heavy. It's not straight away, and it might feel heavy for you with 2 or 3 kilos. So really start slower. If you reach 20 kilo, 30 kilo, it might be heavy for you already. But the most important thing, that it doesn't matter if you do one set of 2 minutes or 3 sets or 12 reps, your muscles need to be tired at the end. So really like last set or last rep should be very difficult. So it doesn't matter what kind of method you choose. The most important thing is for your muscles to be tired at the end, yes? So that's about lifting heavy. And how can I lift heavy if I have a joint pain? So this is also one of the things that happened to me, that I started to have joint pain. And that's also quite common because of the hormonal changes. The joints are getting a little bit more stiff. So that's very, very important to do mobility work too. Strength training, mobility work, and HIIT. So those are the 3 things that you do. It doesn't have to be long. I'm fan of short workouts. The most important thing, you do them. All right, how to start? So coming back to the question, how to start lifting if I have joint pain. So you, again, the same that we were just talking about before. You start small, you start without any weights, and depending where you have a joint pain, it's different for anyone. For me, it's hands. I have hips, and when I lift heavy, sometimes I feel my left elbow, but I had injury here before, So this is just coming back. So when you feel something like this, you just back up. You come back there where you feel the joint pain. You stay with the same weight for a little bit longer. You do your mobility work, of course. With the HIIT training, we have to see if you already have some troubles with blood pressure. You have to talk to your doctor if it's safe for you to do it. Sometimes it's better to do walking sessions or some slow cardio. Just talk to your doctor first if also HIIT training is safe for you. Also for your joints at the beginning, it'd be too much. So we are all starting with low impact and slowly, progressively overload. With strength training, it's like that. With cardio, it's like that. You don't start with 20 minutes of heavy jumping if you have never done it. You start slow, and for sure, the best is to talk to your trainer or to your doctor to see, to check your form and to check if you are safe to do it. Then the next question, okay, do I have to resign from my favorite zone 2 cardio or Pilates? No, you don't have to. Of course, you don't have to resign from your zone 2 cardio if you love to jog and you have time for that. It's great for your cardiovascular health, and maybe you have jogged for your whole life. It doesn't mean you have to stop. You just incorporate 2 sessions of strength training, half an hour with weights that are heavy for you, and you stay with your cardio, of course. I'm also preparing for a 10K run now, and I'm jogging a bit longer, 2 to 3 times a week, preparing for the competition in September. Of course, you can do it, and it might be beneficial for you. The question is now, are you busy? You don't have time for jogging 1 hour every second day. You don't have time for that. What do you do then? Then you prioritize your HIIT training, strength training, a little bit of mobility. Perfect. You don't need more, it's not that much. And twice a week, mobility and HIIT together. But we were talking about Pilates. Pilates is great. Pilates yoga for mobility, perfect. It's great. I'm also Pilates trainer and I love Pilates and I do it, but I use it mostly as my mobility work and core work. Then it's difficult to progressively overload. Of course, if you do the reformer, it's easier because then you have different resistance there and you can also adjust them and then you can progressively overload. But what is important is to choose the training that you do consistently for a period of time, like 3 months, 6 months, and you do the same exercises, and then you can really see your progress. You can see how you progress from day 1 to day 300, for example, and then you will see the difference in your body. Maybe you notice this lower belly fat and you are like, what's going on? I also noticed that. It's like I'm quite slim and now suddenly if I eat something sweet, it's staying on my lower belly. So then when HIIT training comes to work, and you have to really work on that. And of course, changing how you eat. You have to fuel, but you have to fuel well. More protein, you really need it for your bones, you need it for muscles and for your metabolic health. And we are talking about more veggies, we are talking about less fat. You really have to change something. It's not about resigning, it's about adding more healthy stuff, adding more variety to what you eat. All right. How do I start strength training after 40 if I have never worked out? We talked about it already, together with the joint pain and how to lift heavy. Start slow, talk to your trainer, and earn your way towards lifting heavy. Don't compare yourself. For example, my upper body is stronger than my lower body. I can lift much more, and that's because I have the joint pain in my hips, and if I lift too much, I have such a strong pain that I can't really lift anymore. And if you are wondering, will I get big from lifting? No, you won't. Why you are getting bigger? It might be because of what you eat. And look at my arms. I'm lifting a lot, and I'm not getting big here in the upper body. So really don't this is a myth. Good. What kind of symptoms? We have 2 more questions. What kind of symptoms do you have and how do you deal with them? Talked about fuel, joint pain from time to time, the lower belly fat, the mood swings, but this is usual thing after 40. I guess this was the main problem for me, the joint pain, 3 things. How I deal with the joint pain, mobility work, observing my body. If it's too much with the lifting, I come back to the lower weight, observe. If it goes well, I put a little bit slightly more weight and then increase slowly again. If it comes to my hips, I still hold it the way it is, eating clean. So I fuel. But you can't over-exaggerate, of course. If there's also too much of a good thing. If you overindulge, you will see it in your body. When you're 40, 45, it's a little bit more difficult, so we have to pay a little bit more attention. If you think, I don't pay attention, of course I do. I eat everything clean, like veggies, meat, fish, fruit. I love fruit. My indulgence is then sweets. And I eat them from time to time, and of course if you run more you can eat more of them, but we have to be a little bit more careful with that. Yes. How will your channel change? The last question. My channel won't change much from what you saw before. I would just add more content about perimenopause, so you will see maybe a little bit more talks like this. If you have some questions, some updates about perimenopause, how my body is reacting, if there's something new, we can also talk about it if you are interested, and we can exchange our experience. All of us are different. Maybe you have some things that worked for you. Give some tips to me and to some other followers on this channel. This would be great for sure. This will be what will be added to this channel. I will stay consistent with my short workouts. I have always loved them. For our over 40 women, great thing. We are busy, we don't have much time, and it's better to do 5 or 10 minutes a day than not to do anything. And if you really do your mobility and your heat, you have 15 minutes, 20 minutes, and your training is done. So that's the thing. We are staying with 5 minutes, 10 minutes workouts. We are going to see more mobility. The core work will stay here. The core work is always good. You can always incorporate it if you have time. HIIT workouts will appear more often. I love kettlebells. The kettlebells are great. They are great for strength. So if you like kettlebells, there will be some workouts here. And we are going to have also still the mini band workouts. They are good. Just remember to progressively overload. And if you want to focus on some specific body parts, I'm going to leave them here on the channel. So the workouts are staying. I want to also test more different activities. So you have seen I just tested karate, I tested kickboxing, bar, qigong, capoeira. So those are the things that are really like my passion project. But they are taking so long to edit. So that's why I have so few of them. But if you have some ideas what I can try in Cologne or here in Germany, what kind of activities are here from Cologne, let me know. So then I can contact the trainers and try some other sports. So if you're interested how to start some different sports or activities, I'm going to talk about it here. Let me know if you like this kind of content. But I will be really focusing on the women over 40. We are going to talk about perimenopause. We are going to try some new sports and activities, and the 5 or 10 minutes workouts will stay here. I will update you with new things going on in my perimenopause life. So if you are interested with this kind of content, I would love you to subscribe to my channel, give a like to this video. Yes, and let me know in the comments, of course, what kind of content you want to see here. I might get inspired, record something for you that you want, that you are looking for. If there's something that's bothering you that you don't know the answer to, let me know. And for more educational content about perimenopause, check out Dr. Stacy Sims. I will link her channel below, and she has lots of insight to perimenopause, how to train, how to eat. So she's also talking a lot about it if you are interested. All right, thank you very much for joining me today. I hope this video wasn't too long for you. And let me know if you like this kind of work, more relaxed way of talking, acting. Let me know. Thank you. See you next time. Bye.